Hi everyone, my name's Tori and I am a dental hygienist. I graduated dental hygiene school of May of 2016 and then I graduated May of 2018 with my bachelor's degree in liberal arts. So today I'm going to be talking about 5 things I wish I had known about before becoming a dental hygienist. So that's going to include your schedule, education, it's going to include ergonomics, work environment, and then also to career growth and pay. So first thing is schedule and time off. So obviously plus and minuses with that, along with any kind of type of job. So with that, your schedule, I'm gonna go over some of the positives first. So positive is that there is flexibility with your schedule. So right now I have Mondays and Fridays off. In the new year, I'm gonna be adding Fridays for a half day. So that's kind of a good thing with a dental hygiene schedule is there's a lot of flexibility. A lot of offices are sometimes just looking for part-time hygienists. So if you don't want to be at one workplace or one office, you have that capability to be at many as you want and kind of deciding to a degree your hours. It's great, you know, if you have kids, it's something where you can do a morning shift to 8 to 2 or something like that, or if you prefer to do the evenings, most offices or a lot of offices are open until 7 or 8, so you could always choose to do a later shift. I know on Tuesdays I do 1 to 7, which is good because I get my morning off and then I kind of go and do my thing and then I'm home later in the evening. And then kind of the con side to that is that your schedule, there's not a lot of flexibility with it when it comes to like taking time off because we see patients every 6 months. You know, you have to be mindful when you do take time off. It's not something where if a concert popped up next week, obviously not with everything going on, but if a concert did pop up and I wanted to take a Friday off, unless I could find someone to cover me, I probably wouldn't be able to take that time off from work. And then another con with it is that you have to normally get to work a half an hour before your first patient, and then you normally don't leave until a half an hour to 45 minutes after. So if you're working 8 to 5, just know it's gonna be more like 7:30 to 5:30. I've even sometimes had to stay an hour after just to catch up on notes and everything, and then to help clean up the office. So that's something to always keep in mind with that. The second thing is ergonomics. So it's really important as a dental hygienist to have good ergonomics, investing in the right loops, the light, making sure you always keep good posture. I know it's really, really hard. I didn't realize that when I decided to become a dental hygienist. I just thought it was something like easy. You could see all the teeth and you can't. You have to use your mirror. And so making sure that I ask patients to turn towards me or just tilt their chin up or down when I need them to. I don't know why. I get really nervous to do that. I don't know if any other dental hygienists do, but it's just something I have to overcome. It's the silliest thing. And obviously some patients have health conditions where we need to keep that in mind and they have to stay sitting upright. But it's always important to know as a dental hygienist that you are there for 8 hours or more out of the day. So we need to come to a middle ground with our patients where they're comfortable, but then you're comfortable and you're able to see. And also too, if you can't see their teeth well, it's gonna be harder for you to clean them. And then going on to the third, which is education and CEs. So CEs are continuing education. Sometimes they're called CEUs as well. So in Massachusetts where I live, a dental hygienist has to do 20 hours every 2 years of continuing education. And it has to be completed before we renew our license. So March 31st, I have to complete those 20 hours. 10 of them can be online and 10 can be in person. Obviously with everything going on, it has changed a little bit. I've done some online, they're on Zoom, so they do count as in person. And then education, I did not realize how hard dental hygiene school was. I thought a dental hygienist, I thought you checked for cavities and then you polished someone's teeth. I had absolutely no clue about anything that went into it. So that's important to know is that it's a very strenuous, difficult program. I could make a half an hour video just talking about my whole experience, which I will probably do. But just like how a nurse is to a doctor, a dental hygienist is that to a dentist. So nursing programs are really hard. Dental hygiene programs are really hard. I know they're two totally different fields, but they're both health, they're both science. So we do have to take board exams as well, just as a nurse does. In fact, I had to take, let's see, I think 4 or 5 board exams. One of them is in person, and then the rest are all online. One was like an all-day 8-hour course. One was for local anesthesia. The other one was like a clinical one. Then we had a jurisprudence exam. So there's a lot that goes into getting that. I didn't realize I was going to have all these board exams. I thought I was going to be polishing people's teeth and getting paid like awesome money. I don't know what world I was in when I was like 19 years old, but I obviously love it. It was one of the toughest experiences I've ever gone through. It really showed me how smart I am, and I'm really glad that I went through it. And the fourth thing is work environment. So knowing that it's important to have a good work environment, I never realized how small dental offices were, and how if you don't get along with one person or maybe 2 people, how it can affect everything. I've so far, knock on wood, have never had like a bad work environment where I really didn't get along with everybody that I worked with. I've always been able to do that, but if you didn't, I could see how stressful it could be, just because you're around each other all day. You know, it's not like I can go into my office and shut the door and not talk to anybody all day because I'm doing stuff on my computer. So that's something to always keep in mind. And then also too, like knowing like a toxic work environment, and that being in that toxic environment isn't normal. Newer hygienists, I feel like it's easier to be like, oh, this is just what it's like, when it's not. There are great offices out there, and if you don't feel like you're being treated the right way, then that's important for you to get out of there respectfully and, you know, find a job that's going to treat you well. Because we see patients either 2 times a year, 3 or 4, sometimes more. It all depends on the patient's needs. So we're important to the practice, just like how important the dentist, the assistant, everything. Patients are seeing us a lot, and we build a rapport with them. So just know your worth. That's something I wish I had known with that. And finally, going on to the last one, which is growth in career and pay. So dental hygiene is great. It's in its own little kind of niche, which I didn't realize that, like, you know, once you become a dental hygienist, that's kind of it. There is room to do more. Like, you could become a teacher, you could go into research, sales, stuff like that. But to move like past just like being in the like office and seeing patients, you do need a higher education. So like going back and getting your master's. Like, you can teach in a college clinic with an associate's or a bachelor's, but to teach an actual course, you need your master's degree. Research, if I wanted to go into research, I wouldn't really know. So there's a lot of dental hygiene master programs where it's research or education or healthcare administration. Those are kind of like the 3 branches. You can also go into public health, but that is additional training as well. So I wish I kind of known that your growth is only so much. You can obviously go more, but I would have to get more education. So that's something to think about, especially when you get older. With my back, my neck, my hands, carpal tunnel, that's always something to keep in mind. Like, do you want to be in the clinic forever? So just knowing what you want to do, and knowing that if you say, hey, I may not want to be in an office in a clinical setting forever, just getting that education as soon as possible, so that way then you do have those options to explore those avenues. And then this is leading into pay. So what's great about dental hygiene is when you graduate, you can make a very good living for yourself. And obviously there's room to grow and everything, but it does plateau at a certain point. So that's something I wish I had known, that you know, you can only go up so far. Now obviously if an office loves you and they want to keep you and they don't want to lose you, they will, you know, give you bonuses or they'll give you a pay raise. but every office is different. I know, like, I live outside of Boston. I don't live near the city of Boston, but when I look at jobs in Boston, hygienists make a very, very high salary. So that's something, if I wanted to boost my pay grade, I could, but do I want that commute? Because the benefit of being a dental hygienist is you can work in the town you live in, and I live 10 minutes away from where I work, which is great. So all pros and cons and things to weigh out. I hope this video was informative for anybody who is debating whether they want to become a dental hygienist or they're about to go into dental hygiene school and they just wanted a little bit more background about the career. If you have any questions, you can always leave them in the comments. I'm more than happy to help out any fellow hygienists. So take care, be safe, and always remember to make somebody smile.